So not long ago, I did a few videos about the importance of calling your state legislatures here in the Commonwealth of Virginia with respect to the fact that essentially, if you've contracted COVID this year, COVID-19 this year is 2020, and you're a frontline healthcare worker, you remain almost completely unprotected insofar as workers' compensation is concerned in any legal recourse for workers' compensation in the event you get sick on the job from COVID-19. And this is because, as I explained, COVID-19 is an illness that under the current laws, it is not considered an occupational disease, and therefore it's going to be subject to very difficult standards of proof to show that it came from work. So even frontline healthcare workers are probably going to run up against an uphill battle to prove that they got COVID on the job. For sure, the claim is going to be denied by the carrier, and you're going to have to go to hearing. I'm Joe Miller. I hope you're doing okay. I'm a workers' compensation attorney here in Virginia and North Carolina. And today I'm here to talk about, again, some potential very good news that's come along on this issue. The law as it currently stands means is that you got somebody out there who got severely ill on the job from COVID-19. They could be a doctor, a nurse, firefighter, a police officer, and one of our heroes. They're out there risking their life for us. And meanwhile, while they're, God forbid, sick on a respirator in the hospital, their family's fighting to get them some scraps of benefits that they have been denied by the insurance company. Very unfair. Maybe they've got health insurance, yes, but there's certainly going to be thousands of dollars in co-pays. They're going to be piling up while they're in the hospital. No income. Maybe there'd be income from sick leave or something like that, but it's not going to be nearly as much, or if certainly unemployment, not nearly as much as workers' comp is going to pay. So I urge you to call your senators and call your delegates immediately to get this remedied. And let's see if we can pass a bill that will help our first responders and our healthcare providers. So as I said, I'm very happy to report that as of this date, we're now at September 1st, 2020, the Virginia legislature has before it Senate Bill 5066. What Senate Bill 5066 does is it adds to an existing code section which gives certain diseases that are contracted a presumption that they occurred on the job, okay? Which means that they would be compensable, which means that it would be considered an occupational disease. So this proposed Virginia law, this Senate Bill 5066, would add this other section, and it would add COVID-19 as an occupational disease for the following folks: firefighters, police officers, first responders, or healthcare providers. Folks like pharmacists, chiropractors, physical therapists, dental hygienists, optometrists, and many other folks. So if you're involved in the healthcare field, if this statute passes, it's going to affect you. But the biggest thing I want you to know about this statute that's being proposed is that it's going to be retroactive to January 1st, 2020. What that means is that any of y'all who are watching this video, if you or a loved one contracted COVID-19 and you're in one of these categories, you're a police officer, a firefighter, a first responder, healthcare worker of any kind, you are going to have this presumption available to you if this law passes, which means it's going to be a lot easier for you to prove your claim. At the time of this video, we're now, again, at September 1st, 2020. Employers across the Commonwealth have reported over 5,700 instances of COVID-19 on the job. Now, I'm not 100% sure. We don't really know what that means, whether it's just folks that tested positive or folks that said they were actually sick from COVID-19. But we just know that what this means is that these are not people that made a claim necessarily. They're just, the employer has done what they're supposed to do, which is report somebody says that they got COVID-19 on the job. Okay, so they have to make a report of injury. So there's over 5,700 of those now. And out of those, only 481 folks, that's less than 10% of the number, have actually filed a claim, okay, for the COVID-19. And out of the 481, okay, less than a quarter have actually gone to hearing. So there's some number that have gone to hearing. And out of that number, more than half have been denied. That means the case was dismissed, so you don't have a claim. Now, I think if this bill passes into law, you're going to see a lot higher percentage of these cases being accepted and being awarded, and these folks collecting workers' compensation benefits from COVID-19. Now, the other thing I want you to know about this bill is that the fight is far from over. Right now, there are many lobbying groups out there, as they were before. They're still out there complaining about the cost of this, complaining that it's going to be very costly, that it's going to cost insurance companies lots of money, the rates may go up, etc. So the same thing they always say when we're trying to help out folks with workers' comp with the law. But I would argue very, very strongly, and I think this is fairly obvious, that this is simply part of what we have to do, the price we have to pay for protecting our most prized heroes, our healthcare workers and our police and our first responders. This is what we have to do to protect these folks that are out there trying to protect us and help us get out of this mess that we're in. I mean, this COVID-19 thing is nobody's fault. It was thrust upon the world, and we have to deal with it. Certainly, if the federal government can spend trillions of dollars on bailing out, in some cases, big corporations with this PPP money, then certainly the state can spend millions with an M, millions of dollars on protecting these folks that we treasure, these heroes amongst us who are out there trying to do their best to keep us safe during the midst of this pandemic. Once again, I call on you to reach out to your state legislators, your delegates here in Virginia, urge them to push through Senate Bill 5066, which gives us, again, firefighters, first responders, police, all healthcare providers in the Commonwealth, the presumption that if they got COVID-19, it's on the job. Now, just one more thing so we be clear, okay? Some of y'all might be worried, well, what about some abuse here? There might be some abuse, okay? As I said, the law only provides that this is a rebuttable presumption. Let's say you've got a doctor or a nurse, and they have a tendency on the weekends to go out partying on the weekends to bars or what have you, and in those bars, nobody's wearing masks, and in those bars, there's probably maybe it can be shown that there were some positive cases on the nights they were there of COVID, and they weren't wearing any mask protection or what have you, then that would probably be enough to overcome the presumption that they contracted it on the job. But that would have to be evidence that would be presented by the defense. So that places the burden on them as opposed to the burden on the person who is coming forward with the claim. The last thing I really want you to know is that we are currently accepting claims for COVID. If you're in one of these categories, if you're a police officer, if you're a firefighter, if you're a first responder, if you're a healthcare worker of any kind, and you contracted COVID and you have a significant claim, we're going to accept the claim. Now, we may wait a while to file this to see what's going to happen with this law because we want to give you the best chance of success on your claim. I will also tell you that, if you tested positive, you never got sick, but you had to quarantine for a couple of weeks, that sort of thing. I mean, we're happy to show you how to do it. We're happy to give you the information on it. We have packages for that. We're probably not going to represent you, okay? Our firm generally tends to represent the most seriously injured folks, and we have a lot of folks with amputations, and certainly most of our folks, if not all of our folks that we represent, have had surgeries or are going to have surgery. So it's got to be a serious claim, but we will represent you if you contracted COVID, and we're happy to move forward with your claim. So if you or a loved one contracted COVID at any time since January 1st, 2020, you need to contact us, especially if it's something serious. There were lasting effects from the disease that are preventing them from returning to work, or God forbid if they passed, we'd be happy to accept the claim, and we'll move forward with it at the appropriate time, preferably after this law has hopefully passed. If you're working in North Carolina, as you know, we also represent folks in North Carolina. They also have a presumption bill under consideration by the General Assembly in Raleigh. And it differs in many significant ways from the Virginia bill. It's called House Bill 1057. And we will talk about that in another video, but if you live in North Carolina, I urge you to contact your legislators down there and to ask them to please push through 1057. That will be a significant benefit to those folks down there. If you have any questions about this, please don't hesitate to call us. The number on the screen. This is Joe Miller, Workers' Compensation Attorney. God bless you. Have a great day. Stay safe. Joe Miller out.